Hi YouTube, this is Dr. Margolin. We got several questions today. The main question we got is about medications for low back pain, which medication to use for low back pain. Having said that, we still got a lot of comments and questions about coronavirus, which is growing. I'm glad people watched our last video. I appreciate everybody who participated and subscribed. And people suggested different over-the-counter remedies to boost immune system. It basically follows our general advice, and I recommend you speak to your primary doctor or specialist if you have heart and lung disease or multiple medication which to use. I would just mention that, in my opinion, I would add elderberry, which we presented as a tea, as Sambucol. There's a Sambucol tablets or maybe syrups that were proven to fight influenza virus. It may be some benefit to fight coronavirus. And I would maybe suggest zinc lozenges. I would also look into something called buplorium, which is a root, an herb, which was shown to fight viral respiratory infections. Having said, there are no studies. There is some experience, there are some studies on elderberry, but no studies for coronavirus. Sometimes my guess and my experience as good as yours. Sometimes I have more experience, so definitely we can try different things. Be aware that supplements can interact with medications, so again, ask your doctor. Having said that, let's talk today about low back pain. It's very common and very nasty condition that interfere with your daily function. So the question, which medication you should take for low back pain?
Hi, my name is Michael. I'm a patient of Dr. McGolan's, and I wanted to share with you this survey because I've been a patient of Dr. McGolan's for like the last 3 years, and he has earned my respect, he's earned my trust, and I feel like I've made the best decision in the world to have him as my doctor. His staff, they've been exceptionally professional, as well as himself. Any concerns that I have, they get addressed. And he makes me feel like my health matters.
Hi, I've been with Dr. Margolin since February of 2014, and I have gotten better relief of pain, more mobility, better quality of life, and I love the care here and the people here. They're all wonderful.
Hello, I'm William Gibson. I'm a veteran. I came to Dr. Margolin 3 years ago. I'd been suffering from pain for over 20 years, severe pain, and my regular doctor had me on oxycodone, which only brought me down to about a 3 pain level. After being interviewed by Dr. Margolin, he put me on a whole new pain regimen, and I experienced complete relief of pain for the first time in over 20 years. I would highly recommend that you see him. He'll do a wonderful job for you.
Hello, my name is Vicki Curry, and I've been coming to Dr. Margolin for about 4.5 years now. And I am really happy to be here with him because he shows a lot of concern about my health, what's going on with me, and he gives me a lot of good advices and medications as well to help me. I appreciate the fact that I have him in my life. I don't know what I'd do without him. Thank you.
All right, guys. So let me talk to you about low back pain. And again, it's almost impossible to do it in 5 to 10 minute video the way I asked to present it. But let me give you some perspective and you can look it up. You can ask more questions. So these are your discs. First question, is low back pain associated with a disc problem? It could be. It's not necessarily true and not in the majority of cases. If you have disc bulge, like here you see the red bulge, it can hurt by itself. It can pinch on the nerve, like you see here. This is the bulge, this is the nerve. But generally, the disc can be like hockey puck. It can move. It can move. And the spine, if you look at it, it's very flexible. These are facet joints. These are vertebral bodies. We call it the vertebral bones. You see, it's very, very unstable. What keeps it together? Well, in real life, it's even more unstable than here. It has some internal kind of a fixator, but plastic rod that keeps it together. In real life, what really keeps it together are the muscles around the spine. And many times, most of the time, for a young healthy person, the most common cause of low back pain is muscle sprain or strain. That means that it has nothing to do with the disc, nothing to do with the bone, and it's just muscular pain. And that is why the best medication, and I would argue it in details in the second part of this video, it's actually prevention and strengthening of core muscles. I'll give you some suggested exercises. Any other medication that I'm going to review is secondary. Now, if you talk about chronic low back pain, it gets much more complex. We typically talk about axial low back pain, which is related to the pain in the axis, in the middle of the back, which can be related to facet joints, that can be related to discogenic pain, can be a combination with muscular pain and radicular pain, which what people call pinched nerve. This is a separate entity. If you have pain that lasts for a long time, I would say more than 3 to 6 weeks, you need to look for detailed evaluation, and you may need additional medications. For acute episode, like in the question we got, I'm not sure that medication is the first and the best option unless for temporary pain relief. And let me go over some medication option and give you pros and cons, and then talk about what else can be done. Thank you. Okay, so I was asked to review most common medications. I'll try to do it briefly, and then I'll make some additional points. First, NSAIDs and Tylenol. NSAIDs is like ibuprofen, Advil, naproxen, are those medication non-steroidals. Used to be the first line for acute or even mild to moderate chronic pain. Not anymore. They have a lot of side effects. New guidelines do not recommend you to take NSAIDs for more than 2 weeks. We try to avoid prescribing that because of the side effects. They do work, but they can hurt your kidneys and stomach. Tylenol, fairly good medication for mild pain. You can take it within 2 gram range. Don't go over 2 gram. Official recommendation talk about 4 grams. We like not to go over 2 grams, 2,000 milligrams a day. Muscle relaxants, that's the second medication that people asked about. May be good for acute pain. Not the first line. Avoid benzos, avoid Valium. Valium can cause problem. You can get what people call hooked up. You can get dependent on Valium, and Valium combined with opioids can be deadly. Mostly studied medication, in my opinion, for chronic use is baclofen. For short-term use, there are others. I would use it for short period of time if there is muscle spasm not controlled otherwise. Gabapentin, Lyrica, good medication for chronic neuropathic or radicular pain. We just discussed what is radicular and axial. Even axial pain, which is chronic, can be treated with this medication. They can cause drowsiness. They don't give you immediate pain relief. They have fairly few interactions and side effects. And again, opioids. That was the second common question, and that's a question we asked many times. There's most of our consults here in Central and Southern Ohio. Is a patient good candidate for opioids? So let me tell you right away, for acute low back pain, like we were asked, no. Most probably the patient is not candidate for opioids. In some cases, when other medication failed, like many other consults, the people were on opioids for a long time. They failed other medication, including those. Opioids can be used as second-line medications. Opioids can be short-acting, like Percocet or Norco, long-acting, like Amascontin, Oxycontin, fentanyl patch, and some other newer long-acting medications. I think if you require opioids, then I would say come to pain management. Make sure you properly monitor. There are a lot of risks. And the last group is topical medication, including compounded. They can be used for chronic pain. I think to some extent they can be used for acute pain as well. For example, lidocaine patch can be some kind of topical patch that can over the counter that can be used for acute pain. Again, we can talk much more about it. It did not mean to address any specific cases. It meant to be just general overview. Always talk to your provider. What I want to bring your attention to is that CDC, and we can enlarge it, CDC can guide us. It's not written in stone, but there's some suggestions on how much opioids we should take. That's also was a question. It depends on the case. Generally, above 20 MMEs. MMEs is morphine equivalent. For example, Norco 5 or Vicodin 5, 4 times a day, it's 20 MMEs. So above that, your risk of death increased by 2. And it increases significantly above 50 and then above 90 MMEs. So high doses, 90 MMEs is, for example, Percocet, they say it's 60 milligrams of oxycodone a day. So it could be packaged as Percocet 10 6 times a day. We usually don't prescribe it that much. We prescribe up to 4, so it could be a combination of long-acting and short-acting medications. Also, it could be a combination of morphine, of fentanyl, and short-acting medications. Ask your doctor about how many MMEs you're on. If you're above 90, I would worry about it. I do not recommend for non-cancer pain, with some exceptions, post-surgical pain, some other exceptions, but usually we are concerned about 90 MMEs, primarily here in the state of Ohio. Having said that, I wanted to bring your attention to what you can do. Again, I said medication is not my primary focus. My primary focus would be prevention. And I think the best prevention, remember I showed you the spine, how flexible it is and how paraspinal muscles keep it together. To do simple exercises. This is just an example. You can find much more online. You can go to physical therapy, get detailed instructions. It doesn't mean to be detailed advice for every specific patient, but generally planks like that, airplaning, left leg, right arm, front bridge, tabletop. You can do tabletop with 45 degrees. The good planks, once or twice a day. I recommend twice a day. Very short time, takes you 5 minutes. You do it like push-ups. You do it every day for 6 months. Don't try to be perfect. Try to be persistent. After 6 months, you actually build your paraspinal muscles. You're preventing acute episode of low back pain. This is in a nutshell. Again, I think it was a very good question. It's a very common condition, very common question. I was glad to answer this question. And again, thank you. We noticed some growth and questions and subscribers. I really appreciate everybody who participates in this channel and contributes to it. Thank you so much.